Is it possible for a woman to get pregnant even after she's had a miscarriage? Welcome to my channel. Today I answered this question on my channel, Pregnancy Solutions with Gerard Massa. We talk about pregnancy, we talk about everything connected to pregnancy. Well, without further ado, we shall begin with the big question. What causes a miscarriage? What is a miscarriage? A miscarriage is the spontaneous loss of a pregnancy before the 20th week. Many miscarriages occur because the fetus isn't developing normally. Problems with the baby's chromosomes are responsible for about 50% of early pregnancy losses. Most of these chromosome problems occur by chance as the embryo divides and grows, although it becomes more common as women age. Sometimes a health condition such as poorly controlled diabetes or a uterine problem could also lead to miscarriages. Often, however, the cause of miscarriages isn't known. About 8 to 20% of known pregnancies end in miscarriages. The total number of actual miscarriages is probably higher. The main reason is that some occur even before women discover that they are pregnant officially. The question is, what are the odds of another pregnancy ending up into a miscarriage? Now, this is a bit tricky, but we shall go to the basics. Miscarriages usually occur at once, but most women who miscarry go on to have healthy pregnancies even after they've had the miscarriage. A small number of women, roughly we are looking at 1%, will have repeated miscarriages. The main goal is to identify what could be causing these repeated miscarriages. The predicted risk of miscarriage in future pregnancy remains at 20% after one miscarriage. After 2 consecutive miscarriages, the risk of another miscarriage increases to about 28%, and with 3 or more consecutive miscarriages happening, then the risk goes up to roughly 43%. When is the best time for pregnancy even after a woman has had miscarriage? Now, we shall begin by saying that miscarriages can cause intense feelings of loss. You and your partner might also experience sadness, anxiety, or even guilt. Don't rush the grieving process. Typically, sex isn't recommended for 2 weeks after a miscarriage. This is basically to prevent infections, because you might not know really what has been causing the previous miscarriages or what caused this miscarriage. So we always advise couples to at least wait for 2 weeks before they have sex once again. You can ovulate and become pregnant as soon as 2 weeks after miscarriage. Once you feel emotionally and physically ready for pregnancy, even after a miscarriage has happened, then I would advise you talk to your healthcare provider for advice and professional support. After one miscarriage, there might be no need to wait to conceive. After 2 or more miscarriages, your healthcare provider might recommend testing. When we talk about testing, these are simply the standard tests which can be ordered or which can be done on a woman who has had miscarriages in her previous pregnancies. We shall begin by looking at the blood tests, and specifically a sample of your blood is evaluated to help detect problems with hormones or your immune system, because we've discovered that some pregnancies end up in miscarriages due to an imbalance in their hormones, in a woman's hormones, or even the immune system being autoactive, or the immune system bringing about the miscarriage by itself. The other type of test which can be done on a pregnant woman who has had a miscarriage is the chromosomal test. This is mainly because couples may be having abnormalities in their chromosomes, and once we do this test, once we look at the chromosomal makeup of a woman, then it's very easy to identify whether there's an abnormality in the chromosomes making up the genetic complex of a woman. The procedures can also be done to detect uterine abnormalities. These procedures or these radiological studies include ultrasound. This imaging method, I'm talking about ultrasound, this imaging method uses high frequency sound waves to produce precise images of structures within your body. Your healthcare provider or your sonographer will place the ultrasound device called the probe over your abdomen, and this will give images of your uterus plus the whole surrounding structures, including the cervix or the fallopian tubes and the ovaries. An ultrasound might identify uterine problems such as fibroids within the uterine cavity. The next test we shall look at under radiological checkups is the hysteroscopy. Your healthcare provider will insert a thin lighted instrument called a hysteroscope through your cervix into your uterus to diagnose and treat identified intrauterine problems. So with a hysteroscope, the instrument, which is having a small bulb on top, is inserted into your cervix and images can be achieved. Here, abnormalities can be identified. Our next investigative checkup is the hysterosalpingogram. Hysterosalpingography, also called the HSG test. Your healthcare provider will put a small tube into your vagina and cervix to release a liquid contrast dye into your uterus and fallopian tubes. The dye traces the shape of your uterine cavity and fallopian tubes and makes them visible on X-ray images. This procedure provides information about the internal contours or the internal makeup of your uterus and even your fallopian tubes. Any obstructions can be seen by this specific dye collecting at the point of blockage or at the point where adhesions are present. It's the same checkup which is used to tell whether a woman is having adhesions or whether a woman is having total blockage or partial blockage, the HSG or hysterosalpingography. Our next investigation is the sonohysterography. By sonohysterography, specifically a small amount of liquid, also called normosaline, is injected into the hollow part of your uterus through your vagina and cervix. This procedure provides information about the inside of your uterus, the outer surface of the uterus, and any obstructions in the fallopian tubes can be seen. We also have the magnetic resonance imaging, commonly abbreviated as an MRI. This imaging test uses a magnetic field and radio waves to create detailed images of your uterus. If the cause of your miscarriages can't be identified, don't lose hope. Most women who experience repeated miscarriages are likely to eventually have healthy pregnancies. Is there anything that can be done to improve the chances of a healthy pregnancy? Well, this is a question which has been asked many times, and one thing I will have to say is this: there's nothing you can do to prevent a miscarriage. However, making healthy lifestyle choices is important for you and your baby. Take a daily prenatal vitamin or folic acid supplement. This can be easily got at your nearest pharmacy. You could also get folic acid and vitamins in foods which are really available at your nearest shop or supermarket. You can always get these and they can really be so helpful. These foods are always recommended to be eaten just before you go into conception or before you get pregnant. The other advice we give is that women planning to get pregnant or women who are planning to lower the chances of the miscarriage miscarriages happening, should limit caffeine and avoid drinking alcohol, smoking, and even using illegal drugs, so that we end up with a healthy pregnancy. What emotions are likely during subsequent pregnancies? Once you become pregnant again, after even having a miscarriage, you will likely feel joyful as well as anxious. While becoming pregnant again can be a healing experience, anxiety and depression could continue even after the birth of a healthy child. Talk about your feelings and allow yourself to experience them fully. Turn to your partner, family, and friends for support. If you're having trouble coping, then we advise that you consult your healthcare provider or a counselor for extra support. Thanks a lot once again for staying with me up to this point, and let me know if you have any questions in the comments down below. Please remember to subscribe to our channel so that many women out there can discover more of these pregnancy tips. Gerard Massa, Pregnancy Solutions. We talk about pregnancy, we talk about all the solutions that can be availed to you. Have yourself a fantastic day. Like and subscribe to our channel, and I'll be talking to you once again. Bye bye.